Hello friends, welcome back. My name is Dr. Vijay Bhatia. Today I'm going to talk about hypochondriacal disorder and how do we diagnose, what is the criteria for diagnosing hypochondriacal disorder. What is hypochondriacal disorder? The essential feature is a persistent preoccupation with the possibility of having one or more serious and progressive physical disorder. So the person believes and is preoccupied by the thought that they have some kind of serious physical disorder. Patient manifest persistent somatic complaints or a persistent preoccupation with their physical appearance. So either they are focused that they have some kind of underlying physical disorder, for example like cancer, or they are very much focused and preoccupied by persistent feelings that there is something wrong with their physical appearance. For example, they think that their nose is not straight or is bent and they need investigation that something is wrong with it and they want it to be repaired. Normal or commonplace sensations and appearances are often interpreted by patients as abnormal and they are distressing, and attention is usually focused upon only one or two organs or systems of the body. So if they have some kind of feelings, let's say in the stomach, they believe that these sensations are because there is a serious underlying physical disorder. For example, there might be a cancer in abdomen, in liver, in pancreas, and they strongly believe it, and it is very distressing to the person. There might be some slight sensations of abnormal movements, but the way the patient interprets those sensations and feelings, to them it is something very serious which must be investigated and which must be treated. And the same thing for the appearance. For example, in our case with where the nose is slightly not straight, or there is a slight mole on the nose, or there is slight discoloration, or the nose is slightly bent on the side, they believe it strongly that this is not right, something serious is wrong there, and they would seek the specialist opinion and keep on going to the doctor because it is very distressing to them. And attention is usually focused only on one or two organs or system of the body. So when we talk about the facial appearance or breast appearance or any ear appearance, so they are focused only on one or two either systems or organs, and mainly with the system is the commonest one is with the cancer and with the heart disease, or sometimes in women problems with their gynecological problems or some kind of stomach problems. Sometimes because of these persistent symptoms and they're distressing and they've been present for a long time, marked depression and anxiety are often present and may justify additional diagnosis. So they may suffer with hypochondriacal disorder, but along with that, if they fulfill the criteria of major depression and anxiety or mixed anxiety and depression, so they may justify additional diagnosis. Hypochondriacal disorders have a number of other different names. Number one is called body dysmorphic disorder. So it is mainly to do with the appearance, like a nose or breast or even genitalia, but in other people it can be focused on some kind of underlying serious illness, like they have a problem with their stomach or heart, and they might be suffering from cancer. And dysmorphophobia is another name, and we call this non-delusional because we believe that it is not a false belief. There might be something very minor which they take it very seriously, and sometimes the explanations help for short periods but not for long periods. The other name for this is hypochondriacal neurosis, because they are so much worried, anxious, getting tense, and thinking about it all the time and affecting their daily life. Therefore, it is like neurosis, hypochondriacal neurosis, or even simply hypochondriasis, or sometimes we call nosophobia. And they actually name the disease. Persistent belief of at least 6 months duration must be present. So it is not just 1 or 2 days or 1 or 2 weeks, or you have some investigations and then gone away. They must have at least minimum of 6 months duration, and often it is much longer, sometimes years. It doesn't go away despite number of investigations, number of treatments, number of examinations. They keep on coming back saying the same thing. I suffer from cancer in my stomach or something, and can you investigate? I've been treated before, I've been done this, I've been investigated again, and despite the reassurance, it doesn't go away. So of the presence of a maximum of 2 serious physical diseases, of which at least one must be specifically named by the patient. Sometimes it's the commonest, I suffer from, I'm going to have a heart attack, I suffer from angina, I suffer from cancer of the lungs. So they will name at least one. Remember, these disorders, they have to be differentiated from somatization disorder, in which normally the person will complain, the physical complaint, in number of different organ systems like circulatory system, genitourinary system, gastrointestinal system. Out of the 14 symptoms, they must fulfill the 6 criteria. But in hypochondriacal disorder, they normally are focused on 1 or 2 systems, and they name the disease, that this is the disease I want to be investigated. Persistent preoccupation with the presumed deformity or disfigurement, body dysmorphic disorder. So in this one, it is focused either with the cancer or the cardiac problem. Here, they are very much focused that there is something wrong with their nose, with their face, with their breasts, or with their body fat. They are very much preoccupied, and it is persistent that there is deformity, and we use the word it's presumed deformity. There might be slight alteration, but the significance given to it is huge, to a distressing level all the time. Preoccupation with the belief and the symptoms cause persistent distress or interference with personal functioning in daily life. Sometimes they even don't do the work they are supposed to do. They don't even wash themselves or get ready sometimes, because they are very much focused as if they are going to be doomed if it is not treated, if it is not functioning. They will keep on talking to different people and trying to get help and support, and literally they are not able to do their daily living functions. And Sometimes when the doctors keep on reassuring them there is nothing wrong, they have investigations, blood tests have come back, x-rays come back, scan reports have come back, there is nothing wrong, they don't agree with that and lead the patient to seek medical treatment or investigations or equivalent help from local healers. So if they will keep on going to the doctors one after the other, to the different doctors, to the specialist team for investigations, examinations, and if they are not available or if they keep on pushing them away, they start going to the local healers to get the help regarding that illness which is presumed. There is persistent refusal to accept medical reassurance that there is no physical cause for the symptoms or physical abnormality. They start blaming the doctors that they are not investigating properly, they are not doing the right test, they are not doing the right investigations, and demand and complain. Short-term acceptance of such reassurance, that is for a few weeks during or immediately after investigation, does not exclude this diagnosis. So while they are having investigations, or if they have some test and they're waiting for those test reports, during that period they might be fine for a short period, but the moment they get the result and the results are negative, they are not happy, they will demand more tests, they believe there is something seriously wrong and nobody can stop them. They will go to the local healers, try self-medication, use different drugs, and sometimes change their food habits, sometimes change their things that they use on their body or face, and so they are very much preoccupied and literally cannot get out of their mind. Most commonly used exclusion is, so this diagnosis, hypochondriacal disorder, should not be diagnosed in anybody who has a diagnosis of schizophrenic disorder like paranoid schizophrenia or schizoid disorder or catatonic schizophrenia, or even in patients who suffer with mood disorders, severe mood disorders like severe depression, severe anxiety, or bipolar disorder. When it is quite severe, they can get very much focused on some kind of either body is not right or body part is not right, or sometimes they start believing that there is some serious underlying illness, which are sometimes called nihilistic delusions in severe depression with psychotic symptoms. Well, thank you for watching this video. Press the like button if you like the video and share with your friends. Subscribe the channel for more videos on the mental disorders. On the one hand, if hypochondriacal disorder is diagnosed, normally because it's a psychological concept and there is no underlying physiological or biological illness or disease which has been identified, therefore literally there is no medical treatment. However, these patients can be helped with psychologist, with cognitive behavior therapy, anxiety management, and long-term talking therapy. If they do suffer from mental disorder like a depression, anxiety or mixed anxiety and depression or bipolar, or if the persistence of these symptoms have caused them to go into depression, then those must be treated accordingly, and anybody suffering from these symptoms must seek a professional help to get the right treatment. Thank you for watching, and I see you in my other videos on the similar topics and mental disorders.